Yes, the name of my project poster is Increasing Independence and Personal Hygiene Skills for a 10-year-old boy with autism. um, as I start off with the introduction, it's about a 10-year-old boy who has ASD. With this, he should have some self-esteem, social acceptance. The rationale for this was personal hygiene routines such as toothbrushing, deodorant application, face washing. Those are three that's essential for daily living skills that support the health. We want to be social acceptance. That's one of the things that was brought to the attention by expressed from both the participant and his mother, the parent. Children with autism spectrum disorder require explicit instructions. Okay, we found that out. And these routines due to challenges with sequencing, initiation, and generalization of complex multi-step behaviors. The research question that I have was that will a behavioral teaching package incorporated with things such as task analysis leads to most prompting, forward chaining, and reinforcement increase the percentage of steps completed independently for the three items I just mentioned: toothbrushing, deodorant application, and face washing for this 10-year-old boy with autism. The participant setting was in his home, primarily in his bathroom with the door open. Sessions were conducted in the participant's home, bathroom, at consistent daily time, with all required hygiene materials readily accessible. Let me see. So we presented behavioral sociability that's targeted. These skills were socially valid because they were identified as high priorities by, like I said, parents and the educational staff, from the mother, that is. The mastery of these routines is critical for community integration and long-term independence. Okay, the method that was used was a multiple baseline across behaviors, for a single case, experimental design. The percentage of the task analysis steps completed independently per session for each skill was the dependent variable. And data collection was taken by me. All data were recorded daily by the participant at the participant's home. During the baseline, the participant received only a single verbal instruction: was brush your teeth, or with no prompts that follow. To see that, make sure it was done independently. But percentage was what we looked for. Now the results that I had was evident. It shows here that I even had a toothbrushing. It had a baseline of 0 to 60% independence. Deodorant application was 15 to 25% independence, and face washing was shown to be what we call the baseline was 15 to 25%. I even color-coded part of the graph that I have, and I substituted some of the letters that were shown. As far as discussion that we do have for this, it shows here that summary interpretation was that the sequential introduction of this intervention across behaviors combined with stable pre-treatment baselines. It did work basically. All targeted skills achieved criteria level performance and sustained independence following training completion. Okay, limitations was there. Investigation scope was constrained by a single participant. They need more participants, I guess that would be in the future. There was no IOA, as you know. Measurements reliability was compromised by the absence of the IOA. Skill transfer evaluation was limited exclusively to the time in the home rather than generalization like in education. And I have references, multiple references as instructed. I mentioned the future directions as well. So that'll be the topic that I did. As far as what I had in mind, I think I should be better prepared before embarking on any project with the designs. Thank you.